time. You are welcome to continue.
Well, I would like to talk. Yeah, well, since you're giving me that, some people have asked about tampons. Okay, we've had several people ask about that, and I guess everyone knows my position on tampons. But I want to speak as the medical voice, okay, of Jewel concerning tampons. We will not have tampons, and the reason we won't is that when you really think about why tampons came into existence, they came because the pads were inefficient. The pad was just, the blood was, or menstrual flow was just sitting there, making her feel miserable, constantly getting up, having to go to the restroom. And so they came up with the idea of plugging up the vagina so that blood could not come out, so that the woman would not feel so uncomfortable. What they did was they basically robbed Peter to pay Paul. Essentially, they, yes, made the pad more efficient, because some women still use the pad as well as the tampon, but at least they wouldn't feel that extreme discomfort. But then they made the toxin even closer to the bloodstream by having those tampons sitting inside the vagina. Okay, that the purpose of that menstrual flow is to come out. It is not to reside in the vagina. And by residing in the vagina with the bacteria that's normally there, and every woman has what we call good bacteria and good yeast. When I say good, in the sense that neither one of them will cause a pathologic event as long as they are in balance. But when you introduced the tampon, which then held blood within the vaginal wall, it allowed the bacteria to, it's almost like a smorgasbord. It allowed the bacteria to grow in such proliferation that the bacteria had to go somewhere, okay? And it sought any exit that it could. And obviously, as you have read in the newspapers and magazines and other avenues of information, that bacteria went through the vaginal wall into the blood vessels, and in some instances caused toxic shock syndrome, TSS. Now, obviously, when it's at an extreme, it could be fatal. But there are a lot of women who feel uncomfortable, who have low-grade fevers, who have pelvic pain, and some of that is related to an earlier phase of TSS that hasn't reached the point of fatality, fortunately. But the bottom line is we are introducing that condition ourselves. We're doing it by using tampons. And so we decided a while ago that there is no way, if on one hand we're trying to improve women's health, that we're going to turn around and produce something that is going to be deteriorating women's health. So tampons are out because of what I just said. Now, the other aspect from the standpoint of the environment is that most of the sanitary napkins on the market are made with plastic. It's like a bag that you wrap your groceries, you get your groceries in from Kroger or Publix. That's the backing of that pad. Well, as you know, if you try to breathe into those, okay, matter of fact, if you get your clothes from the cleaners, it even says, make sure you keep this bag away from infants and toddlers because of the fact that they could cause suffocation. Well, that's essentially what a woman is doing when she's wearing the sanitary napkins. That plastic, okay, is suffocating the external genitalia, okay, where air needs to actually flow, the air cannot. So now you have an environment of heat, moisture, and what does that do? That increases the risk of fungal infections, bacterial infections, and as I said earlier, we know that bacteria itself produces toxins. So from the standpoint of the pad itself, the ones on the market, no ventilation, our pads will be ventilated. Our pads will allow air to flow so that women will not be plagued by those symptoms. From the environment perspective, plastic takes years to decompose. I'm sure you've seen all the shows showing how plastic is all out in the oceans now, the problems it's causing for the environment. Our pads, it's almost like you could say they're biodegradable as far as the covering. 6 months, that's it. They're gone. They're gone. Okay, as far as the material, all the material, it's gone. Current pads, we don't even know how many years that plastic is around. So from the standpoint of the environment, we will be introducing not only a product that is going to be beneficial from the standpoint of necessity, it's going to be therapeutic from the standpoint of the ingredients, and it will be environmentally friendly, okay, to sustain what we want for society and life to be in the future. So we are the vanguard. We are the vanguard, and everyone associated with Jewel should be proud, okay, and excited on this road that we're on. Now, with that, Ms. Gloria, I think I've said enough.
All right, sir. Well, thank you very much. If you need anything else to say, we will listen. But thank you so much for taking out of your busy day to share all this valuable information with us. We really, really so warm-heartedly thank you for doing that, Dr. Tyrone Malloy. You be blessed and have a great day. All right, ladies and gentlemen, as I've said before, I must say again, Six Star LLC subsidiaries and any future holding companies, we make no medical claims, health claims, nor any other claims about our premium sanitary pads. The testimonies you hear are from actual users of our products and their personal experiences and results that will vary from person to person, user to user, which may or may not reflect the views of our company and its brand.